much. You have been missed. I know I had to shuffle my shift for a little bit. And so by the time I came back on, we had to had to appease the gods to bring you back in. So it's good to have you here. How have you been, Dr. Magnus?
It's been good, and God has been faithful.
Okay.
I'm making progress. Yeah.
That's good. That's good to know. I've had a few people reach out to me, even while the conversations with Dr. Felix were not on, even while we were on break. I've had a few people reach out to me and say, please, I need the good doctor's number. Send me his information. And we have done just that. And I hope that he has been helpful to you, for those of you who have requested a private time. I'm sure you've had a number of people who say, oh, I was listening to you on Nigeria Info, and I heard this and I heard this, and I thought I need to speak to you. Confirmed? Yes?
Yeah.
Yes.
Yeah.
Okay, fantastic. That just shows how much of a resource that you have been, and we're grateful to have you back on the show.
Yeah. Thank you.
All right, Doc. So we are talking about infections and how they affect our reproductive health. Last week, we started the conversation and we talked about syphilis. But while I was discussing with Dr. Felix, he said, look, some of these things, people hear them every now and then. How about we delve into the ones that are not so commonly talked about? And so he decided that we should take a look at the one we're looking at today, herpes simplex virus. Yes, Doc? Okay.
Yes,
so
that's
just
correct.
A bit of a background information. Apparently, herpes, is it okay if I just call it herpes? Do I need to call it the full name?
No, herpes is fine.
Herpes, okay, fine.
Yes.
So I wasn't sure if the herpes that people say is the same as the herpes simplex virus. So I needed you to clarify that one. That's why I said, is it okay if I just call it herpes?
Okay, I didn't get that. You said what?
Okay, so people know or have heard of the infection of the virus herpes before. But, being the doctor that you are, when you said herpes simplex virus, I was like, okay, is this the full name of herpes? So that's why I said I was going to ask if it's okay if I just call it that, just to be sure that they're the same thing, yes?
Yeah, they're the same thing.
Okay.
Herpes simplex virus,
Okay.
HSV for, short, any of them that, but herpes is fine.
Okay, all right. So as I want to do with conversations, especially around health and lifestyle, when Dr. Magnus talked about it, I said, okay, I'm going to go look it up. And apparently, herpes is a significant public health concern in Nigeria. It's said to have a high prevalence rate for both HSV1 and HSV2. I'm sure Doctor is going to get into all of that. But studies have shown a high seroprevalence of both these strains, if I could call it that, of herpes, HSV1 and HSV2 in Nigeria. A systematic review and meta-analysis estimated the pooled seroprevalence to be 74.0% for HSV1 and 63.4% for HSV2. Some studies have suggested a higher prevalence of HSV2 among men compared to women in specific populations, although other studies indicate the opposite or no significant difference. Now, I just thought to put that information out there. So in case you haven't heard of herpes before, apparently it is something that is gaining. I don't know if the right word to say is gaining ground, but it's definitely something that is of major concern within the health sector. Married women have been found to have a greater risk of HSV1 and HSV2 infections compared to unmarried women in at least one study. If we're diving a little bit deeper, among pregnant women in Abakaliki, apparently a study was conducted, and the overall prevalence of HSV was about 62.50%, with about 40.91 positive for HSV1 and another 21.59 positive for HSV2. Now, even me, as I'm reading it out, it's sounding like mathematics in my head. And that is why we always like to have the doctor here, so that he can break these things down for us, make us understand it in its entirety and in the simplest and easiest layman, if possible, terms possible, so that we can talk about it. So at this point, I will hand over my mic figuratively speaking, to Dr. Felix to just take us in on what this whole thing is and why it's important that we're talking about it. Go ahead, Doc.
Okay, thank you very much for this opportunity once again. Just like we said, we're discussing herpes, but just to give a little background on these infections, they're all forms of sexually transmitted infection, including the syphilis that was talked about previously. The sexually transmitted infection are those infections that are transmitted between sexual partners, through any of the sexual routes or contacts, which could be anal, vaginal, or oral. And usually they have some impact on both sexual functions as well as fertility. And that's why it's important we talk about them. In terms of, the broad classes, we talk about those that are, curable. There are some of them that are curable, and there are some of them that are not curable, but they are only treatable. Talking about the curable ones are the ones that most persons are usually aware, like gonorrhea, chlamydia, trichomonas, syphilis. They are all forms of curable sexually transmitted infections. While the non-curable ones, also called the treatable ones, includes most of the viruses like herpes simplex virus, which we are discussing today, human papilloma virus, which we will discuss some other time, and the big one that everybody knows about, human immunodeficiency virus known as HIV. These are all forms of non-curable but treatable sexually transmitted infections. Generally, sexually transmitted infection, when they come or when somebody contracts it, many times you may not see any obvious symptoms. Symptoms means you may not see anything to suggest that this person has a sexually transmitted infection. Yes, some persons may not have any manifestation. But if they do have manifestation, usually the manifestations are in two broad classes. They could be in form of discharge, maybe some form of discharge from the vagina or penis, as the case may be, or some form of ulcers. Ulcers are known as wounds, maybe wounds on the genitals or the mouth or the anus, as the case may be, depending on which of the sexual routes was used in the process when it was contracted. So STIs are quite important because, just like we said, the fact that you look at somebody does not necessarily mean you will know if the person has STI or not. Many times, the most likely way to know if somebody has STI is to go for some form of screening test. That is the way to know. I remember, one of those days, a patient came to me asking me, what does he need to do, to be able to know when people have STI or not? I was telling him, of course, STIs, you can't just say if somebody has it, except you do some screening tests. And even some of them don't even have any specific screening test, especially the non-curable ones. The non-curable ones, some of them don't even have any way to know. It's just based on the history. The person volunteers some information to you. Then if you're able to see some clinical manifestation like symptoms, either discharge or ulcers, which some persons may not have. So these are the things about STI, why they're so important. But even beyond the initial thing that STI can cause, like the pain, discharge, the wounds, is the fact that when some persons have forgotten that they even actually had all these things around them, maybe during their heydays when they were sowing their wild oats, when they have forgotten, maybe 30, 40 years afterwards, they begin to cause some sequelae. Sequelae means, complications following, an infection that was contracted in the past. For the men, some of them may come down with a difficulty in passing urine due to narrowing of the urine pipe called the urethra, which is common in those who have had some form of gonorrhea in the past. Sometimes this may be coming 40, 50 years after the infection was contracted. At that time, the person even has forgotten. The person is now a good man, praying and studying God's word. Then it will remind you that, well, we had some deal in the past. So this is why STI is so important. It's good to really be aware so that you could be guided. Maybe as an opening statement, I would like to say we can't discuss STI favorably or exhaustively without talking about the ABC of sexual education. We talk about this in terms of A being abstinence, B means be faithful to one partner, C means use of condom, what we call consistent, correct use of condoms. Then D has to do with, use of drugs. A is always better than B is always better than C is always better than D. Why? Because of these things I've enumerated, that sometimes, there may not be any symptom to tell you that this STI was contracted, but it may just be the fact that you found yourself having sex with somebody else, in which case you're no longer abstaining. And if you're not abstaining, in which case you're now on B, if you're not faithful with a single partner, that you're sure of the person's status, that the person is not having multiple partners, then it means you have the risk factor for contracting any of the STIs. But of course, if you can't also do this, then you have to ensure correct and consistent use of condom. Because condom to some extent protects against quite a number of them, but it's not 100%. There are some STIs that cannot be protected or prevented by condom, especially the non-curable types like the herpes simplex virus, the human papilloma virus, and also the HIV virus cannot be completely prevented by the use of condom.
Oh, wow.
These are so important. Yes, these are so important. It's very important to say.
Sorry, yeah. I need to come in there. Maybe it's because you haven't... I'm sure by the time you're done with the conversation around herpes, maybe you can understand better. But a lot of people have this understanding that when it comes to not just preventing pregnancies, but also preventing STIs, the way to go is condoms.
Yes.
So you're saying that condoms don't completely protect against some STIs? I thought that was a given for all STIs.
Yes, it has some rule. I mean, quite a significant rule, meaning that it protects against quite a number of them, but it's not 100%.
Oh.
Some of them can still, go through, and some of them, can bypass, condom. When we say bypass, meaning that the condom, we wear it over the shaft of the penis, but it doesn't envelope the entire penis completely. So any exposed portion of the penis, like towards the root of the penis, that has contact with, the sexual partner, can still contract some of these viral infections. So that's why I say it's not 100%. Not talk about the fact that it has to be correct, consistent use, because if it breaks in the process or it slips away, of course, you have many other problems coming from there. So let's quickly go into herpes, which we are discussing today.
Right.
So just like you said, herpes full name is herpes simplex virus. It's a viral infection. Most viral infections don't have cure. We already know that. That's why we say they are treatable. They are not curable. They're usually treatable. Yes, we may have medications to, treat them so that, you can reduce the disease burden, but by no means take them out completely. So that's the way herpes is. And usually there are two major types of herpes, viruses that are commonly discussed. There are other types, but usually the HSV1 and HSV2, that is herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 usually causes more or less oral infections, but it can also cause genital infections, while the herpes simplex virus 2 usually causes genital infections. But both of them are transmissible via sexual contact. They can be transmitted via sexual contact.
Is that the only mode of transmission? Just sexual contact?
Of course, don't necessarily just the only mode. Of course, like herpes simplex virus 1 sometimes can be transmitted through kissing. That's why sometimes you see children when they have, high fever, or when they are sick, you see some herpes, what they call cold sores, appearing on their lips, or rather at the angle of their mouth, because some of them have been kissed by adults that have this herpes, and they have contracted it by that very fact. But that's usually HSV1, so to say. Yes, so that's another method. But generally, any of those body fluids that come in contact with, somebody can actually transmit any of these herpes, but commonly sexually. And herpes simplex virus infection, just like we say, it's a viral infection. It can cause, sexually transmitted infection. Can also sometimes be transmitted to the unborn child. To the unborn child, for instance, if a woman who is pregnant contracts herpes, yes, it can actually pass through the placenta barrier and cause some form of congenital herpes simplex viral infection in the unborn child. And many times these infections can contribute to some of the miscarriages, especially early miscarriages that people suffer during pregnancy. There's what we call the Touches complex. I won't go into the nitty-gritty of that, but herpes is one of the organisms implicated in the Touches complex, which can affect a pregnant woman. It goes through to say, yes, just like we said, many times somebody contracts herpes. The most important risk factor for contracting herpes is sexual activity, meaning that once somebody is sexually active, it means the possibility of having herpes is there. But if somebody is not sexually active, apart from the oral infection that can happen from kissing, the chances of having herpes is very, very slim, if not impossible. And that is why we say A is always better than B, and B is better than C. Okay, and usually when herpes is contracted, one of the first things that somebody may notice is the fact that the person may see some form of, discomfort around the genitals, including some tingling sensation and pain. Then there may be appearance of some form of, rashes or swellings that looks like, grapes, tiny grape-like, swellings around the genitals, and that is similar to the cold sores that usually happens, around the mouth when people have high fever. You may notice that around the genitals, sometimes, especially in the initial phases. Then this sometimes may resolve on its own spontaneously, meaning that it may disappear without any treatment, for some persons, usually, especially the first infection. Then subsequently, it may reappear. Why does it reappear? It reappears because many times, even when it resolves, it doesn't disappear from the body. It goes to hide in the nerves. Nerves are like, conductors found within the body. It goes to hide there. And it stays there until whenever the environment is suitable, then it gets reactivated again. And that is what it does usually, so that, somebody who has contracted herpes, the chances is that even after initial treatment or resolution, another episode can come back. And many times, things that reactivate it may include stress, repeated exposure, or any form of, depressed immunity. These things can reactivate herpes, so to say. And sometimes when herpes is reactivated, it usually follows, the nerve dermatomes, so to say. Nerve dermatomes are just like I say, the conductors found in the body that transmit impulses or transmit signals. So herpes usually tends to hide around those things. And that is why, when you see them, there are multiple around the genitals, In terms of when herpes appears, usually, for some persons, when they contract, they may not have any symptoms. We already said that. For some persons who have symptoms, the most constant way of being sure whether this is herpes or not, apart from the appearance, is that some tests can be done. There's a test that when it's done, the swellings or the rashes can actually be taken. Part of it can be taken and subjected to some examination. And in that case, the virus can be detected. And that is the most, constant and the most, ideal way to make this diagnosis, apart from the clinical presentation. But other methods of also having an idea or making some diagnosis is a blood test, in which case the body's antibodies to the presence of the virus can actually be detected. Antibodies are soldiers which the body produces in response to infections. So if you see a lot of antibodies against this virus, it means the virus is in the blood.
Okay.
Even though this test is not very specific, yes, but it still helps to some extent.
Okay.
So and by these tests and some other things like the clinical presentation and the history of sexual activity or being sexually active, the patient can actually be suspected to have herpes simplex viral infection.
Okay.
And usually, yes, there are some medications that can help Usually once the medications are given, the patient takes the medications. It helps to resolve those symptoms, those manifestations, but it does not cure the virus so that it can still come back after another time.
Okay, let's take a quick break, Dr. Felix. When we come back, we will get a little more specifics on this virus, all right?
With food. But to hang out with great food paired with Star Rice.
New realities, true conversations, trustworthy ideas, shared passionately on your number one talk station of the nation. Nigeria Info 95.1 Abuja.
Let's go. Nigeria Info.
The hub for information,
Current affairs and more.
The president used his last Democracy Day address to talk about several issues, including security.
It is this same government that they started it. They don't obey court order.
Join the conversation
right here.
Let's talk. Welcome back to Tonight with Somi.
We are back, and we are on Body and Soul, the segment where we get to look at everything that contributes to the health of your body and how it impacts your soul long term, because a happy body is a happy soul.
Yeah.
I'm right on that, right? A happy body is a happy soul.
A happy body is a happy soul.
It sounded like something that I just formed. Say it again, sir. How did you put it?
I said the body carries the soul.
The body carries
the
the
body is
soul.
like the container.
Yes.
That moves the soul to wherever the soul needs to go. The soul cannot just move like that.
So if you have a happy body, your soul will thank you for it. And we are talking about reproductive health, but specifically looking at infections, STIs, sexually transmitted infections. Dr. Magnus, there was a time when we used to call these sexually transmitted diseases. Are we still allowed to call them that? Because there was a transition from STDs to STIs. Do we still call them diseases, or are we supposed to just stick to infections?
We stick to infections because not all infections will lead to a disease state. Some of those infections, just like we said, some of them resolve spontaneously.
Okay.
Some of them are transient, so that's why it's better to stick to infections.
Okay. All right, makes sense. And the viral infection that we're talking about this night is herpes, aka full name. When they say, what's your name? You don't just say, my name is herpes. You say, my names are herpes simplex virus. Yes. So, but in short, it's called herpes. And Dr. Magnus was giving us the download of a lot of what we need to know about herpes. But I want to bring you back to, because before we went on the break, you had started to talk about some medication, right, that can be taken. But I want to bring you back to maybe a little bit earlier. I know you have said that not all STIs present with certain kinds of symptoms, but even if you want to go and get tested, like except you're doing your maybe annual medical checkup, your body will be telling you something. Like there's a way your body will be feeling that will make you think, okay, maybe I need to go and get this test. So I want us to come back a little bit and talk about in detail, maybe in a little more detail, some of the symptoms that will make one think, or signs that will make one think, I really need to go and get tested. And I also heard you say earlier that maybe there may not be specific tests that one can say that they want to go and get. So I just want to get clarity on that. Are you saying that, for example, if you run through some of the warning signs or the symptoms, say a person is experiencing some of those warning signs and symptoms, that they can't walk into a hospital and say, I want to get tested for herpes? Is that what you were saying with that? Or is it just that they don't just have this test readily available, so you have to request for it specifically? Or is it that a doctor has to assess you, maybe like a GP has to assess you and then recommend that so and so test should be done? Of course, we're talking about HSV today. What exactly were you trying to say with that when you said that, one, that not all of them present signs and symptoms? Does herpes present signs and symptoms? And then two, can one just walk into the hospital, maybe having noticed any of these signs, and go, I want to get tested for herpes?
Very good questions. Just like you said, not all of them present with symptoms and signs. However, some may present with symptoms and signs. And for herpes specifically, just like I said, first, there must be a history of sexual activity. Somebody who's sexually active possibly has had sex, then subsequently notices either some tingling sensation around the genitals, some pain, as well as maybe some rashes or swellings. Many times, if it's herpes, because there are other things that causes rashes and swellings around the genitals, other infections. If it's herpes, many times, the swellings are usually like clusters of grapes, similar to what we call cold sores that we see commonly in the mouth of children or even adults when they are sick. So you may see such things around your genitals, Then even sometimes you may not even notice any form of pain or anything. It may just be, after shaving, or maybe after, undergoing some form of stressful period, maybe you're preparing for exam or something. Not just all of a sudden notice such rashes appearing around your genitals. That may suggest that, there's a herpes infection,
okay,
which you may have contracted in the past and it's not being reactivated. I've had somebody who came to me, never even suspected herpes at all because, it was just after shaving, but the issue was that why the person was worried was that, usually you shave around the pubic area, but these rashes began to appear on the penis, the pendulous part of the penis, where hairs don't grow, where you don't shave. So he was worried. Are these shaving bumps? So initially he thought, this could be shaving bumps. Okay, but trying to use some of the common cream or medications to treat shaving bumps, rather it was increasing. In fact, it was spreading them more around the same genitals and all those stuff, not even around where he shaved. That is why he became worried. So, but of course, when such a person came, we were able to, examine and check and say, no, this is not shaving bump, this is herpes. Okay, that's what we're saying. That the symptoms and signs, are many times correlated with the fact that somebody may have been you must have been sexually active at the point.
Okay.
Even if it's not recently, it may even be last year, and it's not appearing, following maybe shaving, following stressful situations or something like that. Yeah, that is what we're saying. Yes, and that is why we talk about there must be a history of being sexually active at a point.
Okay.
Those who are never sexually active or have lived a celibate life can't have herpes. That's
like never ever. Like if they've never had it, they can never have it.
They can have genital herpes, of course, genital. Remember, we were talking about genital herpes, because the oral herpes, maybe either while the person was growing up, people who came to carry children will say, hey, fine baby, this, and they'll kiss. Yes, that is possible around the mouth. But around the genitals, where people don't commonly kiss you, I don't think people come to carry children and begin to kiss the genitals. So mean that we don't expect any of such happening around the genitals. So if the person has lived a celibate life, then we don't expect herpes in any way.
Okay.
So mean that somebody who comes and says, I'm still a virgin, I've never had sexual activity, and we're seeing lesions consistent with herpes, then it's either somebody's lying somewhere. But of course, we can go further to do some tests. Just like I said, if the lesions are obvious, like the rashes are there, we can take part of the rashes and take it to a specific test, what we call the nucleic acid amplification test. And with that, we can see the viruses under the microscope, and we can say this is herpes.
Okay.
So, and of course, in that case, we can now make the person understand that possibly you were sexually active at some point and you didn't know that you were sexually active. Maybe you forgot, or
You
Yeah,
didn't
we
know,
see some.
indeed.
We saw somebody who, came with some symptoms. A young lady came with some symptoms. Started vomiting, having abdominal pain. Came, we did. Are you sexually active? No, I'm a virgin. All kinds of things. At time it's not very easy to tell who is a virgin or not. Of course, you can. Of course, you can examine and know, but you can't be 100% sure because there are many factors.
Yeah.
The hymen may not be there for different reasons and so many other factors. So, pregnancy test was negative. I don't know if you're getting. So we also corroborate the fact that this person possibly is telling the truth. But eventually, we went for a scan test, and when we did the scan, we saw changes consistent with a baby that was lost, meaning that she was actually pregnant, some more than like 3 weeks or 4 weeks before then, but the baby has been,
Oh dear.
was lost in the process, but the changes are still there. So
Oh
it
dear.
was when we now began to, say, well, who would have put this in your womb if you've not been sexually active, just like you said? I mean, how did this happen?
Yeah.
So with more questioning, the person now owned up that, well, it's not like she's been sexually active, just that it was just once that he allowed somebody to come there and the person do use condom and everything. But of course, we knew that, those things were just giving us piecemeal because for you to have been pregnant, even if the person used condom, the condom must have broken at some point because pregnancy doesn't just happen. But we're saying that, once somebody has herpes, genital herpes, it means the person must have been sexually active at the point.
Okay.
Yes, so it may be a recent infection or an old infection being reactivated. So in that case, there are tests. Yes, you can just go to the hospital and say, okay, I want to check myself for herpes. You don't even need to, see a doctor if you want. You can just, if you know the test to do. The reason why it's good to see a doctor is to guide you better because some of those tests are not very specific. For instance, the blood test, which most people commonly do, and that's the one that's commonly available, it can be positive, but in the absence of symptoms, it's not so important because there are a lot of reasons why it could be positive. It could be positive from the fact that the person may have had oral herpes while growing up as a child. I don't know if you're getting.
Yes.
So if the person, go for that blood test, it'll be positive, but it doesn't mean the person has genital herpes at that time. So these are all the things around some of the tests. So that is why both the history as well as the examination findings and the tests are usually tied up together to make a clear diagnosis. That's what we're saying.
Okay.
For somebody who suspects that I've been exposed or I have involved myself in some form of casual sex or something, or they are feeling some, okay, for instance, I had another patient who came to me, that, he went somewhere, saw somebody who he got so excited about, and he went through the person in a vigorous manner so that the condom got busted in the process. He was feeling uncomfortable. So I began to ask him that, okay, why are you feeling uncomfortable? He said he doesn't just know why he's uncomfortable. He just feels, I said, did you notice any discharge or anything in the person? He said, no, the person was looking clean. But just that he's so uncomfortable. So lo and behold, we did some investigation, and saw that he had infections. So meaning that even though the casual sexual partner never had any obvious symptoms and signs, but he knew what he did and he wasn't comfortable and he decided to come and request for STI screens. And when we screened, lo and behold, there was STI. So we're saying that, you can actually go and request for those screens, maybe if you feel you've been involved in some, activities or something. Yeah.
Okay. All right. Thank you, Doc. We are making good progress. I just want you to give us a little bit more information. For example, I've heard of 3 types now: HSV1, HSV2, and I've heard genital herpes. Perhaps you could break down the most commonly found or known types of HSV that we have, especially within this part of the world, within this climb. Because, actually, I heard 4. I heard HSV1, HSV2, I heard genital herpes, and I heard oral herpes. So just help us expand on how many types that you think are more, you tend to see more prevalent in this part of the world here in Nigeria.
Okay, that's fine. Okay, well, actually, when you say you heard four types, actually just two types I've mentioned. In terms of the serotype or the viral type, you have
Yeah.
HSV1 and HSV2. That's the discussion. Then in terms of the location, it will appear on the mouth, or it could be contracted through the mouth. It will also be contracted through the genitals. So if it's contracted through the genitals, it's called genital herpes. If it's
Okay.
contracted through the mouth, it's called oral herpes.
Okay.
But whether it's oral or genital herpes, HSV1 and HSV2 can cause both types.
I see.
But commonly, HSV1 causes the oral type more compared to HSV2 that causes the genital herpes. But the two of them can cause any of those, locations. Is that clear?
Yes,
So,
that's
and in
clear.
this
So
part
it's
of the
just
world, of
basically
course,
HSV1 and HSV2. That's it.
yes.
Okay.
And this part of the world, this part of the world, we usually are described as underserved, medically underserved communities. Of course, because medically, there are many things that most people don't have access to very good healthcare facilities and everything. So in medically underserved communities, in developing world or underdeveloped world, as the case may be, genital herpes are very common. Why are they very common? Because most people use sex as a way to relieve stress, poverty, and all kinds of bad conditions.
I'm sorry, did you say they see it as a way to relieve poverty?
Yes, sometimes. You see somebody who doesn't have any other thing to do, is just so idle, thinking of his life. The next person, who is also a lady, is there, not having anything to do. So both of them are idle. So the only thing they can do that nobody will charge them for is just to keep having sex. And they don't have money to buy any protection or anything. So many times you see all kinds of. So that's why I said medically underserved and poorly developed regions is very common, because just like you see unwanted pregnancy and all those things common amongst those kind of communities, because when people don't know what to do, instead of getting too confused, they just engage in all kinds of casual sex. So, and that predisposes them to all kinds of things.
Okay.
Yes, so that's the problem. So usually the genital herpes is common, because of all these things.
All right, Dr. Magnus. So I hear what you said so far. Just want to be clear, because I'm looking at some other things that maybe people can see in their bodies, and I just want to run them by you, and you let me know if actually this applies as well. If they don't, you let us know as well. But you have spoken to quite a number of issues. I want to get this one now. Pain in the legs. I know you talk about pain, but you refer to it within the genital area or the mouth, depending on where the sores are appearing. Do we also see pain in the legs, hips, or buttocks as one of the things that will present in somebody that will make them think I need to go get tested?
Okay, pain in the legs. Well, pain in the legs in somebody who is sexually active, yes, to some extent, even though it's not a very common presentation, because like I said, the herpes virus follows the nerves, the dermatomes. So it can actually happen on any of the nerves. So it can run through any of the nerves. So the fact that it's contracted through the genital doesn't mean, it cannot affect any of the nerves in the body. Yes, yes, but the major thing which I try to bring out this evening is the fact that you can't be thinking of genital herpes or symptoms and you relate to genital herpes in somebody who is not sexually active.
Oh, we get that part. Trust me.
You must establish that.
You said it a number of times, and I'm sure that the people in the back can hear. The problem is, as they have heard, would they adhere? That's the issue. You stress very heavily on the ABCDs,
all
but
these symptoms cannot be correlated to any of these things. But if somebody is not sexually active, you can't really, because means how would the herpes come in?
Okay, let's even touch on that a little bit. So, you also mentioned, as we all know, that children have presented with herpes signs and symptoms, especially the sores, right? And you have said that, okay, this happens when a child is maybe kissed, or a baby is being kissed by somebody who has herpes, and that's how they get to contact the virus. So say, apart from babies, for example, you interface or interact knowingly or even unknowingly with somebody who has herpes, and you're not sexually active with that person, are there other things that you can do within that person's vicinity? Maybe use any of your things and all of that. The kind of way it spreads, or the way it is contracted and all of that outside of sex. Are there any other ways that somebody who is not sexually active but working or living within the vicinity of someone who has herpes, are there other ways that they can catch this one? Or it is largely through sexual activity? Is that all there is in terms of how one can contact it?
Yes, for herpes, usually it's largely through sexual activity, or just like we said, kissing, or if the genital organs comes in contact with the mouth or the anus, as the case may be, or if the person has obvious rashes and all those, swellings I talked about, because many times those swellings are called vesicles. They contain fluid. So if the fluid, opens up and, comes in contact with, somebody, yes, of course, that can also create room for transmission.
Okay, so let me put it again this way. If I use the spoon of somebody who I know has, or I don't know has herpes, will I contract herpes?
No, you shouldn't contract herpes. You will not.
If I use their
it's not
towel,
transmitted
for
like that.
example, will I contract herpes?
You will not. It doesn't spread through fomites.
Okay, so despite the fact that the sores have fluid in them, it does not catch on unless there is sexual contact with the person that has herpes.
Yes.
I
Yes.
see.
It doesn't.
Okay. Dr. Magnus, are you there? Okay, my system is the network is glitching. Let's give it a few seconds. Can you hear me now?
It doesn't, because yes, of course, the fluid and all those stuff, because many times it's not.
Dr. Felix, can you hear me?
I'm hearing you, but it seems you're not hearing me.
Yes, so it was sort of like spacing out, so I didn't catch a lot of what you said, but I think we can move on from there. I've heard you say that regardless of the fact that there's fluid, it does not catch on if you use maybe share their cutlery or something like that.
So it is usually from skin to skin contact with the fluid, not necessarily just for maybe fomites or sharing clothing and stuff. No.
So skin to skin contact, if I shake somebody that has herpes, or is that area?
But no. People don't have herpes usually on the hand.
Okay.
Except maybe you're saying, okay, for instance, let me give you a scenario. There's what they call, some people will tell you that, oh, I'm not sexually active. But when we talk about sex, there's what we call non-penetrative sex, meaning that you may not have penetrated, but you've actually had sex, like dry humping and all the
dry humping, really?
Non-penetrative sex. Yes.
Oh, I see. Okay.
Meaning that in which case there's so much skin to skin contact, and let's assume somebody has a herpes vesicles and lesions, and the process of those friction and the skin to skin contact, so that can create transmission, route of transmission.
Interesting.
That's what I was saying.
Okay.
Yeah, because those vesicles, those fluid come in contact with the skin. Yes. So these are the things we are saying. So such forms of non-penetrative sexual intercourse can actually give room for herpes to be transmitted.
Okay, I have a question here.
Just only, unlike.
Yeah.
Okay.
Finish your thoughts,
not
please.
Necessarily, like for instance, there are some STIs that only gets transmitted via seminal fluid, meaning that only when the person ejaculates, semen or the blood.
Yeah.
Yes, but herpes is beyond that. The fluid from the vesicle come in contact with the skin. And that is why even condom is 100% protected, because the condom usually will not cover the entire shaft, so that those areas that are exposed, the areas of the shaft that are exposed that contains vesicle, rubbing on the other genitals can actually prevent transmission. That's why we're talking. So people also engage in all forms of non-penetrative sexual intercourse like dry humping and all the other things.
I've got one here.
There's no sexually active body.
I've got one here.
Do oral
Somebody
sex and all
asking.
kinds of things.
Exactly. That was the question here. It said, can one get infected via a blowjob, which is basically oral sex? And I'm sure your answer to that is yes. Okay.
Yeah, I already answered that. I said that oral contact, even anus, those who are homosexual, using the genital to fondle with the anus, and the vesicles are on the genitals. The fluid from the vesicles, breaks open, come in contact with the skins of the genitals. That can cause, all kinds of. So that's just like the mouth too. So skin-to-skin contact with the fluid that contains the virus. That's what causes the transmission. That is why a condom is 100% protective, because in the process, first, condom will not cover the entire shaft. Then two, the vesicles that are not necessarily covered from them can actually come in contact with the skin of their sexual partner. That can lead to transmission.
Okay. Something always brings something. Basically, when one is talking about herpes and all of that, what is are there any, apart from, sexual contact, I'm thinking the person that first of all had it and started spreading it got it from somewhere. Is it linked to any maybe kind of thing externally that now causes someone to contract it and then start to spread it within the fellow human race? What did I just say? But did you understand my
You mean
question?
like, for instance, okay, I know what you're saying. Like there's certain diseases that was contracted because men began to have some form of fellowship with maybe monkeys and all kinds of animals. I'm sure, is that not what you're trying to say?
Well, it had to start from somewhere. I was just curious as to where it started from. For example, earlier on in the news today, they were talking about avian influenza. I'm like, it starts from somewhere before it now gets consumed. Yes, and all of that. So I was just curious, any history on where that started from exactly, or did it just show up?
Okay, well, I don't specifically have that information now.
I understand.
Whether there was a specific animal that was implicated. But of course, it started from somewhere, and quite a number of these things, started from, all kinds of the sexual behaviors where people, either for their own personal gains or for reasons of monetary gains, decide to go beyond the limits to do some things.
Okay.
Not necessarily, yeah.
All right.
Really causes some of these diseases. Yeah.
Okay. I mean, if we're talking about prevention, I believe you've spoken to some extent on it. I'll take it from the ABCD, right? Yeah. Abstain if you must, or if you can, and then if you're not doing that, then you want to be faithful to your partner, because the more the partners, the more your risk of contracting it. You've also talked about correct and consistent use of condoms if you cannot do the A or the B. But in terms of drugs as a preventive measure, are there any known drugs, or are there any things that people can take, kind of like how you have a vaccine, for example? Are there any things that are like considered proactive towards preventing or reducing one's risk of contracting HSV? Or when you were speaking about drugs in the ABCD, is this something that will come after one has contracted it? If you could just think on that for a few seconds. I know you have the answer right there. This is your field. You're an expert on all. But I have a quick break to go on to. And when we come back, chances are that we will be continuing the conversation, even also via phone, right? So just, we still have some time and we're going to get into it. But let me go and take this quick break, and then I'll get your response to my question when we come back. Thank you, Doctor.
Thank you.
All right.
New shows, new host, new realities, true conversations, trustworthy ideas, shared passionately on your number one talk station of the nation. Nigeria Info 95.1 Abuja. Let's talk.
And we are back, body and soul, wrapping up in a little bit. And I had just quickly before the break asked the good doctor a question, and I'm sure he'll be answering it very soon. Let's see if we have any messages here. I have Ode John on Facebook saying, "Good evening, Ma, and how are you doing?" Yes. And then with the compliment. Thank you, Ode John. Much appreciated. Emperor Maligna Audu also here on Facebook saying, "Good to see you." Well, it's good to see you too. I'm also taking this time to open up the phone lines in case you have questions for Dr. Felix on perhaps everything we've been discussing thus far this evening, or you have other questions you want to ask concerning STIs. So far, we have dealt with 2 in the last 2 weeks, and we are sort of like trying to wrap it up on herpes today, or herpes simplex virus, also known as HSV in Nigeria. Here, there are 2 types that are that are quite prevalent. According to studies, it says that it is increasing more and more. They're seeing more and more of it. And I was asking Dr. Felix a question on that one concerning the prevention matters, or is it just that when it comes to someone who can't do the A or the B, or they tried to do the C and it didn't work, is there some other form of prevention in terms of the D, which he said is drugs? Dr. Felix.
Thank you very much. Yes, generally for some viral infection or for some STIs, vaccination stands as a way of prevention. However, for herpes simplex viral infection, there are no vaccination that we know currently at this time. However, there are drugs that can be used to treat. And when we talk about treatment, we don't talk about cure, because what the drug does is to clear out the obvious, rashes and the symptoms if the person is having pain, and give some cosmetic appeal, but by no means eliminates the possibility of the person still transmitting the infection to another person, meaning that even after treatment, the person who has contracted HSV can still transmit to their sexual partners.
Wahala.
It reduces Yes, it only reduces the chance. It only reduces the chance, but it doesn't eliminate it. Just like also, it does not stop the person from having another recurrence, in the nearest future. Okay, and that is why the only form of prophylaxis that we know concerning HSV is for those who have recurrent infection. There's some persons who they finish treating HSV now. After some time, maybe few weeks or months, they have another infection. So for such persons, they can be put on what we call, viral prophylaxis, in which case they will be taking the drug continuously for a longer duration, as against the treatment regimen, which for most treatment regimen usually between 7 to 10 days, after which you stop, and we expect that all the lesions and the appearances would have disappeared. Yes, but those who are on prophylaxis may have to continue on this prophylaxis for a longer period. The drug that are commonly used for treating HSV are taken 3 times in a day for 7 to 10 days. While for those who are on prophylaxis, they usually take it morning and evening, what we call twice in a day, but they take it continuously for a while. But it's not for everybody.
How long
It's
is
for
a
those
while? Can we give like
okay,
a
yes, sometimes 6
ballpark?
months to 1 year.
Oh,
Yeah,
wow.
sometimes 6 months to 1 year.
Okay.
Yes, they take it for that period. But that is for those who have been shown to be having too many recurrences, like having up to 3 to 4 episodes of, herpes simplex virus in a year. That's quite a lot. So in that case, you may have to put the person on, prophylaxis to ensure they don't keep having, this recurrence. So, but basically for most persons, it's when they have the infection, they are treated. Then, of course, they are counseled to avoid risk factors that will increase their chances of having recurrence.
I have a message here on Facebook that's alluding to a particular doctor who cured them of herpes, and the name here is it doesn't look anything like what's from these parts. But then they went ahead and put a phone number there that is Nigerian. I would just say, if you're on our Facebook, kindly kindly ignore things like this. I have a doctor here who's saying that herpes is incurable, and then you go ahead and you want to sell market and you're coming to come and post this kind of thing here. Please, if you're on our Facebook, ignore that completely. All right. Even if you want to form like you are doctor and you know it, at least you will give us a believable number. Now you put all those names and everything, and then all these people who just like to scam people, God is watching you. Anyway, Dr. Magnus has been with us on the show. We're about to wrap it up in a few minutes. Let me just bring him back online on the conversation so that we can get his concluding thoughts on it. But yes, we have been discussing about HSV, and I'm hoping that we have touched on all the important aspects of the conversation. But perhaps you have a question or two. Maybe you think that we haven't covered something on HSV that you consider as invaluable information, or information that will help you make a decision. Then now is the time to call in and ask your questions or send your messages. 0700-951-0000 or 009-5974-869 on WhatsApp. The number to call or send your message or voice notes to is 009-993-0137. Hello, good evening.
Hello, good evening.
Welcome.
Good evening. My name is Adewale.
Yes, Adewale, you have a question for doctor?
Yes, that's one. That is talking about what we call now.
Sorry, you said what? I didn't hear you.
Moreover, at that time, when doctor is explaining one thing for the other time, he mentioned that if you have sexual sex with someone, that if you use condom with blood inside that thing, and I want to ask, maybe the thing can happen, it can be pregnant or what?
I mean, that's pretty obvious, isn't it? If Dr. Felix, the question was, if someone is having sex and the condom breaks, can the person get pregnant? I believe the answer to that is yes. Now, that's a no-brainer. That's a no-brainer. Yes.
Can the person get pregnant? Yes.
Okay. Not only can the person get pregnant.
Will not be.
Yeah.
The person can get STIs and every other thing.
Yes. So, like I said, pretty straightforward, that one. Okay. I was asking that people call in case they have any other questions or concerns about this particular STI. But let's speak, as we wrap it up, let's speak to how exactly this particular STI is known to impact on reproductive health. Is there a specific impact for men or a specific impact for women, or does it all just function in one kind of way, whether you're a man or a woman?
Yes, for HSV, for instance, just like we said, anything that impacts on sexual function eventually will invariably impact on reproduction. Because when the person has the lesions over the penis or the genitals, first, you won't want to expose that part of your body to anybody. So that means, sex will really be impaired. Now talk about the pain that the person will experience around the area, Then, of course, because, for instance, like I said, herpes can be transmitted to the unborn child in a woman who is pregnant and contracts herpes. So that also means the child can be born with congenital herpes, and stuff. So when you look at all these, these lines of impact, that definitely is going to impact on reproductive health in one way or the other. Yes, it may not necessarily cause narrowing of the tubes or any of those other things that some other ones may cause, but with the fact that it's going to affect the sexual health, pain during sex, so the person will be shying away from sex, the person is ashamed of having sex. Talk about the fact that, the fear of being transmitted to the unborn child. So all these are all forms of way it impacts on,
Okay.
Then many times herpes usually increases the chance of people contracting other forms of STI, especially HIV. So once somebody comes with a history suggestive of herpes, in addition, one will screen for HIV, one will screen for hepatitis B and hepatitis C, because the chances is that if the person has HSV, it increases the person's chance of getting any of these co-infections.
Interesting.
And that is a very significant, health risk.
Okay.
So in fact, one of the patients I saw, after, never even knew, but when we started checking for herpes, we said, okay, let's just check for the other ones. That was the first time he discovered that he had hepatitis B. He never knew. So possibly whether it was during the process but we just say that we always screen for those other ones because it increases the chance of having those co-infections.
Okay. When it comes to impact on fertility or infertility, does it have any direct correlation? Herpes.
Okay, well, in terms of fertility, right?
Yes.
Okay, well, yes, it does not have a direct, it's not one of those things like mumps that can cause orchitis, in which case of inflammation of the testes, swelling of the testes. It doesn't cause that, neither does it cause, tubal blockage or maybe low sperm counts. It doesn't cause any of such. So directly it does not, but indirectly, of course, it will eventually impact on fertility. But directly, like of course, we've discussed on this same platform that things like mumps, you can develop mumps or orchitis, in which case there'll be swelling of one or both testes, and with that, eventually, to wipe away the ability of the testes to produce sperm. Herpes also do that.
Okay.
Mumps, which is also another viral infection, can do that. Gonorrhea and some other infection that can cause narrowing of the tube, so that the egg, when it's produced, cannot be transported into the womb where implantation occurs, or the sperm cannot travel to the egg to fertilize it. Yes, gonorrhea can cause those ones, but herpes does not classically cause any of such. Mainly, herpes, most of its impact is in terms of, cosmesis and patient's comfort. It doesn't also cause major complications like death, like HIV or any of those other ones that eventually can lead to death. Herpes does not cause those things. It's just the fact that it is not curable, so it keeps troubling the person. You finish treating, after some time it comes back, you start having pain again, rashes all over your penis, you're not confident in having sex.
Okay.
You can transmit it to the unborn child. The child will come out with, sores all over the mouth and all on the body and stuff like that. So those are the major impacts, because it doesn't cause death like some other ones. Neither does it have a direct impact on fertility like some other STIs.
Okay.
Yeah.
So I mean, in terms of reproductive health, maybe not so much. Do you also see a type of herpes where people present with headaches, fever, seizures, changes in behavior, for example, and also with people who have maybe some other underlying ailment or disease, or maybe autoimmune diseases? Do you see, or rather, does the herpes serve to worsen these conditions? Does it like piggyback on these conditions and then make them worse? I know you talked about it sort of like allowing, like opening the door for things like HIV and the rest coming. But yes, but for people who maybe don't have that, but may have other underlying issues or autoimmune diseases, does it serve to worsen their state? And I also asked about the headache. I'm seeing something here called herpes meningitis, and I wanted to get your thoughts on that. Yes.
Yes, of course. It can. Of course, herpes meningitis. Yes, is of course not very common, but it can lead to that. And of course, if the patient is immunosuppressed or has other comorbidities, diabetes and many other diseases, it can actually make the manifestation to be more florid. For instance, the rashes may be more, because it will be easy for the virus to just spread everywhere. So the body cannot even fight it at all. So yes, the presence of other disease conditions in an individual will increase the chance of having the herpes, as well as making the manifestation to be more, and also, more overbearing on the patient, so to say.
Okay.
Yes, that's very true. Yeah.
So treatment.
Yeah.
I see here that, of course, when somebody is presenting with the sores, they go to a healthcare professional, for example, maybe just by visual examination, they can determine, right? Like by visual determination. I also see that.
Grip-like lesions, yeah.
Yes. These colors that you are calling, some of us are quite dark. Are you sure that it will present in those colors? Or like if we see them, we'll be able to determine that, this is what Dr. Felix described in terms of what the sores would look like. Does it present in one particular way, one particular color, irrespective of skin tone and all of that? So that once someone sees, they don't mistake it for maybe eczema or crow, what are those other things, rashes and all of that?
Yeah, of course, it doesn't present in a particular way, but there's some classical presentation like the cluster grape-like, swelling, which would take usually a skin color, meaning that if the person is black, you see black cluster grape-like, or cluster-like grape-like lesions. If the person is fair, but the most important, it takes the skin color.
Okay.
Then, of course, the person may complain of pain around the genitals, some tingling sensation.
Yeah.
Rarely does it cause discharge there. Of course, if the lesions are there, you may see fluid oozing out from those, grape-like lesions, because most of them contain fluid, what we call vesicles. So you may see them weeping sometimes, meaning that they'll be discharging fluid from the swelling. So you now know that most likely this, because another close differential, is the human papilloma virus, which can also present with such swellings, but not exactly who herpes is. And in that case, it doesn't produce fluid like herpes that produces fluid. This human papilloma virus does not produce fluid. So, and that is why, of course, if the patient notices anything that is not normal, don't train to make this diagnosis for you. So just go have a consult with the urologist, and of course, we'll be able to tell the differences and help you get early and prompt treatment.
All right. So treatment in the form of drugs, right?
Yeah, usually that's the basic thing. Yeah, the drugs usually taken 3 times a day for 7 to 10 days. If there's need to repeat, it could be repeated. There's also a cream that can also be applied over the swellings or the lesion or the sites where the burning sensations are being felt. So the cream is not very effective, but it also goes as a complementary treatment modality for those who are already on drugs. Yes, so those are the 2 basic, things that are used for managing the drugs. There are different drugs, depending on which one that is really available to you. But the common one we use is the acyclovir, which, is commonly available. The other ones, even there's an injection that can be used, depending on what you want to achieve. But basically, just like we said, not curable, but treatable.
Okay. All right. Seeing as I don't have any other call, I think I saw the phone ringing a little while ago. I'll just make room for one more call to come in. If you have any questions or contributions to the conversation we're having with Dr. Felix, we're talking about STIs and how they affect your or impact your reproductive health. And we have been dealing very, very extensively on HSV today, also known as herpes or herpes simplex virus. If you have that call, you want to place, now is the time to call in. Let's see. Hello?
Hello.
Hello?
Hello.
Hello? Okay, I think I lost the connection. Let's get your concluding thoughts, Dr. Felix, as we wrap up tonight. It's 11:15, and I'm going to need to let you go.
Oh, great. So we've talked a little about herpes simplex virus. By no means been exhaustive, because you can't just exhaust some of this discussion just in a single day. But just suffice it to say that there's some basic take-home points. One is the fact that herpes simplex virus is regarded as a treatable sexually transmitted infection.
Yep.
Usually the most important risk factor is in one who is sexually active, meaning that those who are not sexually active don't have anything to do with herpes. And that is why sexual education, saying A is better than B, B is better than C, very important, because if somebody has always abstained, then you don't have business to do with herpes. When we say abstain, we mean both from penetrative and non-penetrative forms of sexual activity, because some persons may abstain from the penetrative type, but they don't abstain from the non-penetrative ones. So very important. The other thing is that, of course, it doesn't have a fatal outcome. Those who have herpes, genital herpes, don't die usually from genital herpes, except, of course, in rare cases where they have herpes meningitis. Yes, and if it's not properly managed, then, of course, meningitis, since it involves the brain, can eventually destroy the patient. But however, most cases usually either resolve spontaneously, do well on medications, and most patients will lead their normal life. The basic thing that they usually experience is that recurrence of the infection even after treatment. The fact that their sexual partner will eventually can actually contract the disease from them, even when they don't have obvious symptoms.
Right.
When they have been treated, they can still transmit their sexual partner. So I think it's good to say that see your urologist when you see anything that is not very clear, and your urologist will always help you to sort them out. Thank you.
Okay. I know that you have been, you have quite the open door policy when it comes to access. So are you saying that typically when one presents with any of these symptoms, they don't need to go to a GP? They can just come straight to the urologist?
Yeah, well, if they have access to the urologist, by all means, it's not like they can't go to a GP, but the GP, of course, is a doctor and has their own level of engagement, know what to do, and they also know when to refer appropriately.
Okay.
But, of course, the GP may not have all the information concerning genital herpes. And that is why if you can have access to urologists, but of course, urologists are not present everywhere. Maybe we're in Abuja, so it may be easy to talk about urology, but there's some places where you don't even have a urologist. So in that case, the only person you have then may be a GP. So of course, by all means, see a doctor. The doctor knows what to do and also knows when to refer if it's necessary.
Okay, and the one thing that we do have here on the Tonight Show, especially on Thursdays with Body and Soul, is access to this particular urologist, Dr. Felix Magnus, consultant urologist at Shivas Specialist. Yes, that's the name, sir?
Yeah.
All right.
Yeah,
so
Shivas Specialist Hospital, Urology Center.
Aha, exactly. So it's a specialized center set up to deal with specific issues such as these. So you know that if you need to reach Dr. Felix, you can always send a message either to the WhatsApp number, or you can always send me an email, and we'll see to it that you have easy access to Dr. Felix. Thank you so much for coming on the conversation tonight, boss. We appreciate you always.
Thank you. I really appreciate you too.
Thank you.
Thank you for always having me.
Thank you. The thing with the listeners sometimes is the phone lines are open and then nobody is calling. And then when I start the conversation with you, the phone lines start buzzing again. It happened just a little while ago while I said you should wrap up your thoughts. But I couldn't stop you to take the call. So do you mind if I allow for one final call before we let you go? Would that be okay?
Is the person ready? Then we can answer that.
Let's see. Are you ready? I give it a minute. 07009510000. The good doctor has to go and rest. Or 00959746869. Or WhatsApp is 009-993-0137. Hello? 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 Okay, I can't seem to establish the connection. Please, let me just let you go for tonight, Dr. Felix. You have been amazing. I know you need to go and get sorted and prepare for the next day. Thank you so much. Have a good night, Doctor.
You too. Thank you. Good night.
All right, then. Good night. And now the call is back. Hello? And it's gone. All right, 11:20 is the time. We have spoken extensively on body and soul, and we are bringing the conversation to a close right this minute. Let's go take a quick break, pay some bills, play some music, and then when I get back, today is Thursday, so you know that we are doing it specially today. I said at the beginning of the show, and I said again, all song requests today are going to be taken in dedication to family. So it's either your song is about family or you're dedicating your song as you make your request to your family. Today is International Day of Families. We started the conversation yesterday because I knew that our body and soul conversation will not allow us to have it. So we did the talk yesterday and we're doing the music today. So you can start sending in your song request and make sure that as you are requesting, you are letting me know the dedication to family, how you want it to be. 07009510000 if you want to place that request, or 00959746869. On WhatsApp is 0809-993-0137, which is the preferred method at this time because it's easier for me to just read your message and then go play your song. All right, let's pay that bill and play some music, and I will be right back.
This is Nigeria Info.